Hi, my name is Monique. I'm a breastfeeding peer counselor here at Kenosha County WIC. And what I do is I support you from pregnancy throughout your breastfeeding journey. So, in a pre-COVID-19 world, I would meet you at your certification here at the office and text you occasionally throughout your pregnancy, offer you a breastfeeding class if that was something that you were interested in, and then support you throughout your journey, like I said, as you're breastfeeding. In a post-COVID-19 world, though, we're going to try to do the classes virtually. So today's video, I'm going to talk about getting breastfeeding started. So the first thing that we're going to talk about is positioning your baby. So there are names for the different positions that you'll want to hold your baby in. I won't go through them. You won't remember them. You might not remember them. And to be completely honest, you're just going to hold the baby how you're going to hold the baby anyway. That being said, you just want to keep a few things in mind. No matter how you're holding the baby, you want to make sure that you're using plenty of pillows for support. So that's what a boppy pillow is for. So you would take your boppy, put it here, and then set the baby on top so that it makes it easier for you to nurse. The thing about the boppy is that it's not really thick enough to have the baby up high enough. Ideally, you would really want your baby at breast level. So you would want your pillows high enough so that you could set your baby on top of the pillow and baby's already nose to nipple, just like that. So you want to make sure that your baby is up that high no matter what position you're using. So if you're holding the baby like this, if you're holding the baby like this, if you're holding the baby maybe under your arm like this, you just want to make sure that, again, you're using lots of pillows for support. You also want to make sure that you're bringing the baby to you. So a lot of women will, kind of hold the baby and they'll be trying to stick their breast into the baby's mouth. And it's a much better position if you actually just bring the baby to you. Okay, so no matter what position you're using, making sure that you're bringing the baby to your breast and not your breast to the baby. You also want to make sure that you are tummy to tummy with your baby. So it's really common to, you're holding your baby and your baby, sorry, the ugly baby, sorry. So you're holding your baby and, baby's like, oh, mom, and, kind of turns his head towards your nipple. And that's all he can turn because he doesn't have control over the rest of his body. If you turn your head to the side, put your chin on your shoulder and try and swallow, it's very uncomfortable, and it's uncomfortable for your newborn too, but unfortunately for them, they don't have the muscle control to turn their stomachs. So making sure, again, that no matter what position you're in, that you and your baby are tummy to tummy. So just so simple as turning baby's stomach to face you. Okay. So when you're looking down, you want to see a straight line. You want, baby's face aimed at your body, and then you want to see, that straight line, shoulder nice and lined up. Maybe it gets a little squishy in there with the legs, but it should realistically be a pretty straight line. We'll talk about colostrum too. Colostrum is the first milk that you're going to be producing. Some of you might be producing it now, depending on where you are in your pregnancy. You might have noticed some leaking or some stickiness at the tip of your nipple. You may not have. Some women leak, some women don't. There is no right or wrong, so don't be concerned if you haven't started yet. But colostrum is the first milk that your body is producing for your baby. It's the first thing you're going to feed your newborn. You want to think of it like concentrated breast milk, so it's in this teeny, teeny, tiny amount to feed or to perfectly match your baby's teeny, teeny, tiny belly. When your baby is born, their stomach will be about that big, like the size of a shooter marble. See that? And if you had a mature milk, then baby wouldn't be able to take in enough nutrients. So nature kind of packed it into this teeny, teeny, tiny, powerful punch, so that your baby could get in what they need. Skin to skin is something that you'll want to try to practice at the hospital. Skin to skin is like the first hour, the sacred hour after birth, kangaroo care, all of those kinds of things. And what it is when you and your baby are, when your baby is born, baby ideally will come out and doctor will rub them off a little bit, leave them all gooey, and just put them face down on your stomach, wrap a blanket around you and the baby, and kind of leave you to do what you do. And the baby will start to seek out your breast. That closeness, this is that first bonding period that you guys get, and they're going to start to sniff out milk. So you may notice that maybe you'll do like what's considered like a breast crawl. If you're able to do that, they'll start seeking out your breast. So we say delay the bath. We don't want the baby's hands to be washed because he's covered in the scent of amniotic fluid. It's also coming off your breast, that same scent of amniotic fluid. So it's kind of like a path for the baby to be able to help them find their way to your breast. You may have noticed that your areola is getting darker the later on in your pregnancy, and that's helping to create like a bullseye for the baby. They can really only see the contrast between dark and light, so that darkening helps them also create that path towards your breast. So baby's going to kind of start like kicking at your stomach, which will help to help push the placenta out, and they're like trying to get closer to your breast. So baby might get closer to your breast, might put their mouth around your nipple, they might suck a little bit, they might cry. There's just a lot of things that'll go on in that first hour. All of those things are normal. About 30 to 45 minutes in, if baby hasn't latched and like started feeding yet, then you may want to help baby out a little bit, kind of scoot them up over if they need to be scooted over, position yourself a little better, just help get them on if you need to. So now is a really good time to start considering what the hospital experience is going to look like. Especially if this is your first baby, you have no idea. Have you talked to your doctor about breastfeeding? Have you told them how important this is to you? Have you planned for what ifs? Just all those things. So there is, it's a really good idea to start creating a breastfeeding plan if you haven't already. Some people you might have already created a birth plan, but if you haven't, add in a breastfeeding plan. There is an app called Cofective, and I'll see if you can see that. It's a little shiny, but the nice thing about Cofective is that it has some really good videos. There's questions, help you write your your breastfeeding plan, things that you can ask your doctor. You might not know what to expect right away after birth, so ask your doctor, are you going to give me the baby right away after birth? Will I be allowed to nurse right away after birth? What if there's complications? Just things like that. And knowing where you stand with your doctor, knowing what your doctor knowing what you expect, better allows them to make sure that happens for you in the birthing room. Plus, it just kind of gives you that chance to think about things that you might not have thought of yet. So that's going to be it for this video. Make sure to check out the next couple. We'll do what I would normally do in the class. So see you for the next video.